Hello. Hi, my name is Ginette. Nice
Hi.
to meet you. I'm going to be your nurse. I'm going to be assessing you. I'm going to wash my hands real quick.
Okay.
Okay. Be longer than that. Okay. What is your name?
My name is Olivia.
All right. And what is your date of birth?
6/24/92.
All right. Do you know what day it is?
I think it's Tuesday.
Yes, today is Tuesday. All right. My patient appears the age she stated. She's answering all my questions, and she was alert and oriented ×3. Her skin color is even, and according to her ethnicity and background, it's consistent. She appears well nourished, and there are no obvious abnormalities. Her facial expression is smiling. She's calm and relaxed, and has an appropriate mood and effect. Her speech is fluent and articulate. Her hearing is grossly intact. She's able to hear my questions and answer them. Let's see. She appears clean and well groomed. And at this point of the assessment, we would measure vital signs, but due to lack of time, we won't. Alrighty. Now I will assess your hands and your nails. So I'm going to assess her hands to make sure there's no abnormalities or calluses. I'll assess her nails. They're nice and clean. No abnormalities on her nails. Her skin is warm and dry, and her turgor and elasticity is good. There are no visible lesions anywhere, and her skin is soft and dry. I think I said that already. And then I will continue to evaluate her skin as I go on throughout the assessment. So now I'm going to assess your head and face. If you look straight ahead for me, and just check you out. Her head is rhombocephalic, atraumatic, and symmetrical. I'm going to check your hair now. Make sure her hair is free of infestation, and there are no visible lesions anywhere on her scalp or anywhere. So now I'm going to check your temporal mandibular joint. So if you can open and close. Right, and that is good. There's no clicking or anything. I'm going to check your maxillary and frontal sinuses, so let me know if there's any pressure or pain. Do you have any pain anywhere? Good. All right. And I'm sorry. It's a little cold in the room. I'm going to check your mastoid, your tragus, and your pinna. Did any of that hurt when I touched it? Just tickle? Good.
Yeah, just tickle.
All right, so now I'm going to assess your facial nerve 7. I'm going to have you close your eyes and let me know when you feel something on your face.
No.
All right, so her cranial nerve 7 is intact. Alrighty. Now I'm going to be checking your eyes. So I've got my handy dandy chart. If you can hold this, cover one eye and extend it as far as you can. If you could read the second line, please.
874
Alright, if you could read the fourth one.
is 638.
Okay, awesome. You can switch hands now. Read let's do the fourth one.
Okay, 638.
And then the fifth one.
8745.
Awesome. And she passed. She did good.
Yay!
Alright. Up next, I'm going to use my handy dandy pen light to check Perla. Very reactive. Awesome. And then I can see also, just by the light of the room, I can see the light reflecting equally on both cornea. Now if you can follow the pen light for the 6 cardinal positions. Very good. She passed that with flying colors. And the 6 cranial position, those check the cranial nerves 3, 4, and 6. There's no visible swelling anywhere in her eyes, no lesions in her eyes. Her eyelids meet when closed, and her eyebrows move symmetrically. Her eyeballs are aligned and they don't appear sunken or protruding. Her conjunctiva is pink and her sclera is white. And yes, alrighty. And then there are, her cornea is clear and there are no opacities and everything's nice and smooth. Her iris appears flat and even in color, and again, I already said that she has perla. And now we'll use the ophthalmoscope to check inside and see if there's light. Alright, if you could look straight ahead for me. Alrighty. Alright, I see her optic disc, I see her macula, and I see two. Sorry, I'm so close to you. And I see her, let's see. I see blood vessels. And I would do the same on the other eye. There was the yellow physiological cup and the two vessels going to all four quadrants of the eyeball. And then the retinal background was reddish orange and there were no lesions present. Sorry for being so close. It's hard to see if I don't get up close. Alrighty. So I'm going to test your ears now, and I can see externally her ears are symmetrical with her face, and there is no tophi. I'm going to use the otoscope to look into your ear. There we go. Alrighty. And to assess inside, I will pull down and back.
You can turn it upside down.
Oh, yeah, that's right. I turn it upside down. Oops. And I hold her head for stability. And then I can see. There it is. She has an intact eardrum. There are no lesions. There's no inflammation, no redness. And it's not perforated, so that's good. See if I'm missing anything else.
Do it on the other side too.
Oh,
Or
yeah.
just say that you're not.
And then I would do it on the other side as well. Alrighty, let's see. Now I'm going to test your hearing. So I'm going to whisper a couple words, and if you could repeat them if you hear them.
Dog. Cat. Burrito.
Sounds good. Alrighty. Okay. Oh, and inside her ear, the cone of light was visible as well. I'm going to test your nose, so if you could look up for me. Let me get my pen light so I can make sure it's all good. You can see inside. Her septum is not deviated. It's nice and straight. Her nose is midline with her body and symmetrical. Let's see. If you could cover one nostril and breathe in and out, and then do the other. There's no obstruction in either nostril. It's nice and clear. Okay. And then also her mucosa was nice and pink inside her nostrils, and her septum was intact, and then there were tubercles visible, and there was no sign of inflammation in there either. Alrighty. So if you can open your mouth for me, say ah. Uh-oh.
Let me turn it a little.
Technical difficulties.
Okay, I don't know what it's doing. Just pretend.
I'm gonna use. Let's see, this one probably be better. All right. Hopefully this one can go off for me. All right. She has a gag reflex. Her uvula goes up when she says ah. Her palate is intact. Her mucal membranes are moist pink, and there are no signs of lesions anywhere. Her teeth are nice and white and clean. Her lips are not cracked or dried. So she's doing good there. Let's see. And there's also rugae. Can you stick out your tongue for me? There are no lesions on her tongue. Her tongue is nice and clean as well. It's pink, moist, and midline. Can you go side to side for me? Up and down. Yep, she's good. And let's see. Oh, and her tonsils are they're not swollen, and they in a 4-point scale they are a 0. Alrighty. Alright, I'm gonna check your neck. Her neck is symmetrical, and there are no visible lesions, lumps, or bumps anywhere. Let's see what else. I'm going to palpate your lymph nodes. Okay, starting with the submental, with the submandibular, the preauricular, there we go, the preauricular, the posterior auricular, her occipital back here, and then her jugulo-digastric, her superficial cervical, her deep cervical chain, her posterior cervical, and then down here is her supraclavicular. You can actually feel it. There, is it really very out there? And whenever I touched any of your lymph nodes, were they painful?
No.
Okay, and they were when I assessed them, they were not swollen and they were mobile. Okay, so now I'm gonna feel your carotid pulse. Carotid pulse is very palpable. I feel it on both sides, never together, because I don't want to kill her. I'm gonna hear your carotid with the bell of my stethoscope. And if you could take a deep breath and hold. Good. Now the other side. All right. And I'm gonna listen to your thyroid as well. While I'm here. There are no audible bruits, so that's good. Actually, I'll just keep this with me so we sit again. Her trachea is aligned with the rest of her body. Let's see. Can you turn your head like you're saying no for me? Can you say yes for me? Good. And now if you can turn while I put resistance. Good. All right. And now I'm going to move behind the patient to test her thyroid. Alrighty, now that I'm behind the patient, I'm going to be checking your thyroid right here. Thyroid is palpable over her trachea. It is not swollen. It is movable. Her trachea is movable, and it is aligned. All right, now I'm going to hear your lung sounds.
Sorry.
You could take nice big deep breaths for me. Again. Good. All right. Her lungs sound clear bilaterally. Next, I'm going to see her thoracic cage. You could take a nice big deep breath for me. Good. Her thoracic cage is symmetrical and has no deformities. If you can lower your neck for me, there you go. I'm feeling her spinous process, and it is aligned with no visible lumps or bumps. Does it hurt if I touch your spinous process? It is non-tender and pain-free. Okay, all right. Now I'm going to do tactile fremitus. If you could say 99 for me.
99, 99, 99, 99.
Okay. Vibrations are felt symmetrically all throughout her back, and I'm going to do the same in the front. You could say 99 for me.
99, 99, 99.
Good. Alrighty. Okay, now you're going to feel some tapping on your back, so I can hear some resonance. Alrighty. Good. And now I'm going to be doing a diaphragmic excursion. So if you don't mind, I'm going to pull up your chest. Your chest. Your shirt. Goodness gracious. Alright, I'm going to feel some tapping. So if you can exhale and hold while I tap and mark, okay? Ready, set, go. Okay, alrighty. And now if you can take a deep breath and hold. Okay, and you can breathe again. And now with my handy dandy ruler, I will measure it. And it is around exactly 5 centimeters, which is normal.
Yay! I'm normal.
So now I'm gonna, you're gonna feel a firm tap over your CVA where your kidneys are.
Okay.
All right, and then let me know if you feel any pain. Okay? Any pain?
Nope.
Good. Sorry that my hands are so cold.
It's okay.
All right. Now I'm gonna be checking you out from the front. Get rid of my handy dandy stuff. Alrighty. And I can see right here she's breathing regular and it's unlabored. And like I said before, vibrations could be felt bilaterally, anteriorly and posteriorly. Let's see what else. I'm going to listen to your heart, S1 and S2. Excuse me, I'm going to feel listen down here. Sounds good. Both S1 and S2 were heard with no murmurs or anything abnormal, no gallops or rubs. Alrighty, now I'm going to test your upper extremity. So if you could raise your hands up for me. Side. Now down. Now behind your back. And out like this. Like this. And if you could do the Fallon test for me. Do you feel any pain? No pain indicates no carpal tunnel. So that's a good thing. Alrighty. And now I'm going to feel some nodes. So I'm going to feel, hopefully feel, they're kind of hard to feel. So this is going to be your central, sorry, this tickle, your lateral. Your lateral is right here. Epitrochlear. And then your brachial nodes. They're kind of hard to feel, but they're there. Good job. Alrighty, and now I'm going to have the patient lie down. Goodness gracious. Okay, now that she's laying down, I'm going to be assessing her chest area and her carotid. First, I'm going to, sorry. I'm going to try to feel, okay, hold it for me. Feel her apical pulse. Very strong. It's very palpable. And then I'm going to do it with 3 fingers. And then 1 finger. It's palpable with all 3 ways. I'm going to check, if you can turn your head this way, I'm going to check your carotid and jugular. They're barely visible. And like I said before, there were no thrills or anything like that palpable. See the other side too? Barely, just a little bit visible. Alright. When was the last time you went to the bathroom?
An hour ago.
Okay. So you don't need to go right now? Okay, good. Alrighty, so I'm going to check your abdomen. Do you mind if I hold your shirt? And I can see that your tummy's nice and flat. There are no bumps or lesions anywhere. Her abdomen is symmetrical. Her skin is intact and even colored with the rest of her body. Oh,
Forgot about vowel
vowel sounds. First, I'm going to listen to her in all four quadrants.
sounds. I'm hungry.
You're hungry too?
Gotta hear that one.
The patient's bowel sounds are very active in all four quadrants. Patient's hungry. Alrighty. Let's see. Now I'm going to tap on all four quadrants. Timpani is heard in all four quadrants. And I'm going to check for her liver on her right side. Do you mind taking a deep breath in for me? Hold. Feel the outline of her liver, but it's very hard to assess. But her liver is not inflamed. Is it painful when I do that? And it's not painful. And I'm going to check her spleen between the 10th and 12th intercostal space. So it's hard to assess as it's behind the rib cage. But I don't feel it, so that's a good thing. Does that hurt anymore? No pain, there is no tenderness, and I don't feel any bumps or lumps or anything that shouldn't be there. Alrighty. Right, now I'm going to be palpating her abdomen. Let me know light and deep. Do you feel any pain when I'm palpating? Patient experiences no pain. There are no abnormal lumps or bumps. There are bumps and lumps, but they are normal. It's your ab system. Alrighty. And now I'm going to check her abdominal reflexes. So try to stay calm. Alrighty, here we go. That's one quadrant, second quadrant, third, fourth. So she's a +3 abdominal reflex. She's very good. Okay, so my patient is not comfortable with her checking her femoral pulse or inguinal nodes, but usually I would check around here, or on myself in this area here. And now I'm going to have my patient stand up. I'm going to check your lower extremities. Alright, so legs are symmetrical. There's no signs of atrophy or deformities. And I could see that also when she got up too. She got up with no problem. Her legs they're nice and warm. Her skin color is even with the rest of her body. She shaves her legs, so there's no hair on them. Alright. I'm going to check your pulses on your feet. Belt on both feet. We'll check her posterior tibial on the sides of her feet. And then on the inside of her feet as well. Alright. And I would also check her popliteal, but it's very hard to assess. But since I was able to assess both her pedal pulses and her dorsalis pulses, and those were very good, so that's a good indication that there is good perfusion to her lower extremities. Okay, let me check your toes. Even though she does have nail polish on her toes, I could see around her nail, and then there's good calf refill. Do you have nail polish on your hands? And I can also check them on her hands too. And there's good calf refill there. So on both upper and lower extremities, there's good calf refill. Alright. And her nails are obviously well taken care for. There's no brittleness, no foul odor or anything. They're nice and red. Alright. I'm going to have you stand up. Alrighty. And if you could turn around, I want to feel your hips. You can twist. Good. The other way. Now side to side. Very nice. And now forward and backward. And she has excellent. You can take a seat. She has excellent range of motion on her hips. She has no problem there. Now I'm going to check her reflexes. Do you mind if I pull it out? Sure. So think of a nice and warm, sunny place. I don't have anything on my hand. A little bit. Okay, one more time to make a good one. You're not dead. A little bit. Alrighty. To the other side. A little bit. A little more. Okay. I'm going to check your Achilles. Ooh, that was good. The other side. Very nice. Alrighty. Now I'm going to check your brachial radialis. Hard to say. Alright, 1, 2, 3. Okay, now the other side. Relax. Think of a warm, sunny place. 1, 2. There we go. Alright, and I'm going to check your Babinski. Alright, so Babinski was negative, which is what we want, and all the rest of our reflexes were +2, which is absolutely normal. Alrighty. I'm going to have you stand up again, close your eyes, and touch your nose. Very nice. Alright, so now do with your fingers like me. Very nice. So now if you can stand feet shoulder width apart and have your hands out in front of you. And I'm going to do that for 20 seconds. So 20, 19, 18, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And that was a Romberg test, and she has very, very good balance. Let's see what else we have to do. Oh yeah, if you can touch your toes. While she's touching her toes, I'm going to check her spinous process. It's very aligned. No pain. Is there pain? Nope. Alright, and there are no abnormalities there either. Alrighty, let's see. Alright, if you can have a seat. If you can close your eyes, and I will be handing my patient this. Alright. If you can tell me what that is.
It's a key.
Yes. Good job. If you can keep your eyes closed, tell me when you feel something.
No. No.
There you go. Alrighty. So that's all good. Alright, I'm going to have you stand up one more time. And if you can walk across the room for me. Her gait is very, very good. She has no problem walking or balancing herself. Okay, you can stop.
Okay.
You can stand on your heels. Go on your tippy toes and go on around the circle. Awesome. Alrighty. And I'm going to have you go from heel to shin. Shin to heel. And on the other side. Very good. And if you can bend. There you go. Do a squat. There you go. Awesome. And then I already made you touch your toes and we assessed her range of motion of the spine. You can take a seat. And we are omitting the genital assessment part because for privacy issues. Well, thank you very much for letting me assess you.
You're welcome.
Do you have any questions?
No.
Alrighty. Well, I'll be seeing ya. Thank you. Bye-bye.